Elaine's 8-week ultrasound. Can you believe 8 weeks have gone already? I certainly can't. Sorry to confuse everyone tonight. We are in a different consultation room than we normally are, so everything is back to front. I don't even know how we're going to cope today. So here we have our virtual patient of Elaine, 8-week pregnant. Nurse Tiana is here, but she's just coming off a break, so she's finishing with her phone. I think we'll have to confiscate phones in the workplace. Workplace health and safety. Right. So anyway, let's get started. Hi, Elaine, if you're there. I know you just said before that you're ready, and I'm ready, and I'm sure we'll also have your sister. I don't know if your sister will be there, but I'm hoping she will be. Has everyone, Elaine's sister, prop failure. Elaine's sister is Debbie, and everyone knows that Debbie is having the Down syndrome twins, which were actually due to be born today by a cesarean section. But as I spoke about in our last, one of our last consultations, is that Debbie had the choice whether, if that day wasn't good, that she could make it another time, and so she chose to make it on the 19th, so tomorrow. So we are extra excited for Debbie. Those twins are ready to come and will be born early tomorrow morning sometime. No one will actually be seeing the video that I make until Debbie actually sees those babies, has them in her arms. Then she will actually see the video herself, and then I will share it with everyone. So both Debbie and Elaine have said something. So Debbie said she's here. And I don't think Jessica said anything else. Nope, so we're all good. Okay, so let's get this started. Nurse Tiana, if you could get started with the pulse monitor, please, and I will just check the patient's heartbeat. Back to front, everything today. Okay, good. Okay, so Elaine, you're probably having a little bit of pressure at the moment down low. As everyone knows, when we're doing an 8-week ultrasound, yep, mum has to have about 500 ml of water, 500 ml to 1 litre of water before the ultrasound. So it just really depends on the size of the person. But 500 ml, and so she'll be feeling a lot of pressure down low there, and you might also feel like you want to go to the toilet. So just tell me if you do need to go to the toilet. We might be able to release a little bit there, but generally we'll try to keep it. That will push that uterus up, so I'll be able to see your baby, and you'll be able to see your baby too. So that's all looking good. Can you get the blood pressure monitor out, and we'll check the blood pressure. So I hope, Elaine, that you're ready for your blood test tonight. Everything's going well. I'm so tired, and I've got to get an early night myself tonight to be ready for the birth of the twins, your niece and nephew, tomorrow. Okay, so that pulse monitor is looking good. So if you could take that off now, please. And we'll just do your blood pressure and see that everything's going well with that. So you must be getting excited. I mean, since your sister is having twins, you might be thinking, oh, what if I have it running in the family or something? It's always an exciting time. So just relax there. And we'll start that. So that's filling up. Nice and tight, just the way we like it. And see how that goes. It's like a relaxation room in here, isn't it? Great, all good for that. Feel okay? Yeah. Okay, so just take that off. Nurse Tiana, if you could put that away, the case is over there. Don't drop it on the way. Okay, so I'll just check this belly. Everyone can see we've just got little tiny belly. At this stage, some mums think that they have a little bump, and there's definitely always a little bump there, but normally it's some kind of water retention. It's not normally the bump itself. It would be very small still at this stage, but it would push the belly out a little bit like this, especially at this point when all that bladder is full and bringing belly up. So isn't it cute? Cute little belly. Good, okay. So before we get on with the ultrasound, we'll do the blood test. So Nurse Tiana, if you can get my gloves and my mask and get the syringe ready for me. Mask. Okay, so Elaine has said something. Yes, please. So, yep, she's all ready. She's just said she's fine with the blood test. All is good. So get your gloves on as well and your mask. I hear that when I do these blood tests that it's not for the faint-hearted. So if you personally don't like to watch blood tests, then you can look away when I say that it is painless to the patient. They might feel a little anxious about it, but in reality, there's nothing. Oh, it's another warm night here in Queensland. I've got the fan going, air conditions as usual, don't cope. So it's very warm. Okay, so let's just check this. Okay, good. Tourniquet, please, when you've got your gloves on. Can you just, after I put the tourniquet on, can you just get the swab and swab the area, please? Can you relax? Just checking if that is, no, it's not. Elaine? So I'll be doing this now, so even if you did message me, I probably wouldn't be able to message you back. So Nurse Tiana's just got one of the sterile swabs, wipes it over the area where the injection will be, just to sterilize it all, and then we'll do the injection. So just checking that. Good. Can you make a fist? Can you go like this with your fist? And hold it. Excellent. Okay, just hold it for one moment. And Tiana, if you can get behind me so you can, behind me. She'll get there. So you can release the tourniquet. Okay, so you can relax your fist now and tourniquet can be relaxed. So look away if you're feeling a bit faint. Don't like to see these things. Okay, have you got the sample jar ready? Okay, so there's the blood test has been taken. So can you put the Sharpie in the Sharpie's bin and put the sample in the sample tray to take away to pathology? Excellent. Oh, so hot. And there's my mask that can be put in the bin too. Okay, so are we ready for this ultrasound? I will just it's all okay. Feel comfortable with that? Mm-hmm. Good. Okay. So I'll just get the machine ready. And if you can, once you've done that, get the ultrasound, wireless ultrasound out. And let's see some baby. Or babies, you never know. Okay, so Debbie has said something. I have to put my password in. Oh, wow. So Alison, my oldest baby, this is Debbie talking to me. Alison, my oldest baby, got excited when you said about her brother and sister. So that is the Down syndrome twins. Their biggest sister, Alison, heard about it and got very excited. So that is really excited. They've got to look forward to those two babies coming. Okay. Yep, you can go around. Actually, yeah, go around me. So at this stage, the external genitals still have not developed, but I can do a gender prediction like I normally do. That's based on like a heart rate, but it's normally just a bit of a wives' tale. It's not always not to be 100%, true as such. So let's get this going. Comfortable. Nurse Tiana has got around the other side to get ready for the heart. Okay. And we will start this. Are you comfortable there? Okay. So I'll have to make some notes as I go. Would you mind just handing me a pen just behind you? Thank you. That's perfect. And let's get this started. So hoping that I can have everyone see that pretty good. Yes. There's not a lot to see at this stage as the baby is so tiny. Okay, just looking around at the ovaries. There's an ovary there and the fallopian tube. Just checking. So here's baby, and we have one sac. So we just have one baby. I'm just going to measure the head there that I can see in this area. You can see the baby's head and its spine going up to like what we call as the tail. At this stage, the spinal cord has dropped, has disappeared, as I should say. So it's not so much of a tail there anymore than the rounded back end of the bottom type of thing. You can see there, I can see a little heart beating there. So baby is definitely heart beating. So also another little fact is the little fingers and toes. If you've seen, a fetus in the beginning, they've got like a webbing between their fingers and toes. Well, that isn't as prominent anymore. You just get, yep. You can see baby there, that's the head. Really clear, the head, the spine, down to the legs over here. Just doing some measurements. Baby's looking really good. So I just have to check. It's not really as common at this stage, but you can notice a little bit if there was some fluid behind their neck, and that's what we noticed with Debbie's twins, and found out that they subsequently had Down syndrome. But they're the lovely babies, and everyone's so happy for them to come. So we've got a little heart beating just there. It's beating nice and strong. Okay, so let me just finish it there for one moment. Okay, and well, let's get the heartbeat going. Okay, Nurse Tiana, you know the deal about turning that on? Actually, I've just, don't pull it yet. I'm going to pull up the ultrasound over here, and hopefully you'll be able to see that. Because what you want to look at on the screen is when I go in closer to the heart, well, you will see the heart beat coming along the screen, but another thing you might notice is that it starts pumping blue and red, and that's the blood pumping through the baby's heart. And it's all part of the tests that we do, make sure everything's going well. So you'll see that in a minute. So turn that on.
It is.
It's on. Is it on? Can't hear any sound.
Oh, I managed to turn up.
That's all right. No, that's good. Okay, so can you see that there? See the little lines going across the screen there? You can see the blue. That's very hard to see, I know, in the distance. I'm just measuring the heartbeat area here now. And there you can see the blue and red there. Hopefully you can see it on the screen. There's a different colour. Okay. So you can turn that off now. There's Tiana. Okay, we'll just finish off the last measurement that I need to do. And I just need to grab a picture. Awesome. Okay. So Nurse Tina, I will get you to take that away and print out that picture for us and bring it back when it's all ready. So we're doing really well. Baby's heartbeat is great. So, so basically the size is about just 1.1 inch, which is about 2.6, 2.7 centimeters. The weight at this stage is you expect around like 0.5 of an ounce, which is 1.5 grams roughly. Let's see what else I have to say. Obviously, Elaine, you need to stay fit, stay well, drink plenty of water, healthy fruit and veggies. It's all over the internet. I don't need to tell you. We still like our little treats though, ice creams, cheeseburgers, all those kind of things. They're all great as well, but in moderation. So obviously, if you put too much weight on in a pregnancy, it's harder to get it off afterwards. Okay, so we have your printout here, and here is your little bean. So that is your little baby. And as we were talking about before, you'll get that in your in your 8-week packs. What am I talking about? As I was talking about before about the gender prediction. Now remember for sure, this is not 100%. It's just based on the heartbeats, which I wrote that down. Actually, it's down on the screen. Excuse me. Okay. Okay, so that's around. It should be around anywhere between 120 to 180, but it's even in the lower rate, so it's about 130, 135 beats per minute. And so my gender prediction on that is it is a boy. But we will see that, if you want to see that, at the 18-week scan. So that's very exciting, something to look forward to for everyone. So where are we up to now? I think we have all finished with Elaine's 8-week ultrasound. So like I said, everyone, please, prayers and everything for a healthy and happy cesarean birth tomorrow morning for Debbie. And probably the video for that birth will be up probably in about 4 to 5 days, probably next Monday, Tuesday, I would say, as I'll have to do some editing and get it all ready to be viewed. So don't forget, anyone, if you have any questions, pop them below, and obviously subscribe to me to see more videos. There's more coming up, and thank you for watching. I'll just check and see if Elaine has anything else to say. She doesn't at the moment, but thank you. Congratulations, Elaine. A very healthy baby in there. You should be so proud. It's coming along so great. So thanks again, everyone, for watching, and we'll see you next time on My Pregnancy Clinic. Bye.